I think the future is very, very bright. By the year 2025, we find a cure for the disease. And I think the field is really driven to move toward it. It's like landing a man on moon.
I think in the last 5 years, we've really gained understanding about what causes Alzheimer's disease and what are some of the earliest changes. And with that, then we can use that to help us develop preventive therapies and really try to find ways to prevent Alzheimer's.
What I'm particularly excited about is the way we've been able to organize all of the investigators who have wished to use imaging in their cutting-edge research. I think we'll be able to find those answers faster and get to a cure faster.
And watching the staff build these relationships with our patients and their families and our participants, and seeing how it becomes a family, and a family really dedicated towards addressing this disease in all its aspects.
The ADRC grant came at the right moment for our research. It came at the moment where we identified an important machine, a biochemical machine, that impacts in the pathology of Alzheimer's disease.
And it wasn't that long ago that scientists really didn't understand that preclinical stage. So we have accomplished a lot.
This is the first time Alzheimer's disease research centers have included a health services research grant or a health systems implementation grant. And yet I would argue that this is a population that needs our help the most. They are highly, highly vulnerable. And if we can create healthcare systems that are optimally designed to support patients and their families with dementia, then they're going to help everyone else as well.
My vision is a world without Alzheimer's disease, and to get there we need to reliably diagnose this before symptoms occur and also have effective treatments.
We have done a lot of observation. We know what the brain changes are that happen in the preclinical stage, and I think it's time that we start prevention trials.
People talk about the sadness of the disease, but there's something to the sweetness, and there's something about physically caring for someone. It can be a real hardship, but there can also be this really incredibly rewarding part of it.
I think the people who actually make everything that we do possible are the participants. None of this would have been possible without them. So to you all and to your families, I want to say a big thank you.
What I tell my children is that in the process of science is an exciting adventure, and that the answer to the needs of mankind will come from science.